Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, November the 9th. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, we'll be providing a written briefing with case counts and the latest information about COVID-19 in British Columbia. And then on Thursday, we'll be here in the press theater, and at that time, in addition to the regular COVID-19 briefing, Dr. Henry will be providing updated modeling and other information relevant to the COVID-19 pandemic in BC. And with that, I'm honored to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So for today, for our COVID-19 update, we are reporting on two periods from Saturday to Sunday. And in that period, we had 536 new cases of COVID-19 in BC, and from Sunday to today, an additional 462 new cases. So that is 998 new people diagnosed with COVID-19 in the last 2 days, giving our total of 18,714 people in British Columbia with COVID-19. Of the new cases, 210 are people in the Vancouver Coastal Health Region. Sorry, I think there's an error in these. Oh no, okay. 737 are people in the Fraser Health Region. 12 are people in Vancouver Island Health. 28 are in Interior Health Region, and 11 people in the Northern Health Region. We have no new cases and people who normally reside outside of Canada. We now are up to 4,891 active cases across BC, and as you can tell, in all health authorities, of whom we now have 133 people in hospital with COVID-19, 43 of whom are in critical care or ICU. Sadly, we have an additional 5 people who have died from COVID-19 in the last 3 days, bringing our total number of people to 281 people who died. And as always, it pains us to know that people have succumbed to COVID-19, and we send our condolences to the families of these people, to their care teams, who I know are also upset every time we lose somebody, and to our communities. We have 9,179 people across the province who are now under active public health monitoring, and 13,425 people who are now recovered from COVID-19. We've had 2 new healthcare outbreaks in the last 2 days, one at the Harrison Point Long-Term Care and one at Normanna Long-Term Care Home. And 3 outbreaks have been declared over at Fairhaven Homes Burnaby Lodge, the PICS Center, and the Gateway Assisted Living for Seniors. That leaves us with 37 active outbreaks in our healthcare system, 32 in long-term care or assisted living, and 5 in acute care. That includes 1,255 people, 715 residents who have been affected, and 535 staff. So today I want to speak a little bit about the new measures that we put in place on Saturday. From the outset of this pandemic in British Columbia, the goal of our COVID-19 response, as it is across this country, has been to maintain our capacity, ensure that we have our capacity in our healthcare system, because we know that's important for all of us, to protect those who are most vulnerable, and we know now more about who those people are, but they continue to be overwhelmingly our seniors and elders, and to keep as much going as possible in our communities. On Saturday, I put new regional orders in place for the Vancouver Coastal and Fraser Health Regions to ensure that we can continue in meeting these goals. The written orders will be available later today on my Provincial Health Officer website, and they will be in place for 2 weeks. And that is a critical time. We know that the incubation period of this virus is 2 weeks. So what we are looking at, the cases we've been seeing now, are people who were exposed 5 or 7 or 10 up to 2 weeks ago. What we need to do now is to break those chains of transmission so that in the next week and 2 weeks, we will start seeing those numbers come down, reflecting that we are no longer exposing large numbers of people. The purpose of these orders is to break those chains of transmission. And we know that those transmissions were happening at a rapid rate in some parts of our province, particularly, as we know, in the Fraser Health and Vancouver Coastal Health regions. And when we look back at the people who were becoming infected in those regions, we saw that the virus was being spread in social gatherings in people's homes, whether it was a birthday party, a dinner party, having people over for receptions after weddings, etc. We know as well that the virus was being spread in a number of workplaces, and so people were bringing the virus with them to work inadvertently and spreading it in places where they were congregating, mostly with other workers. We also know that it was indoor group physical activities that were being amplifying the virus in some cases, and this led to spread that then again went into the community. We also know that this virus was being spread when people were traveling around the province. This, of course, increases our risk, not just in those areas where we're seeing increased cases, but around the province. We know that this virus moves with people, and it is us who have the ability to stop that transmission. So, as we said on Saturday, orders are a last resort, but they are what we need to put in place right now to address those areas where we were seeing transmission happening and expanding rapidly. This latest action in our COVID-19 response is about putting the brakes on the virus, breaking those chains of transmission. It is a short-term pause on non-essential activities and travel to ensure that our essential activities like school and work and healthcare can safely continue. The focus is on reducing our social interactions and focusing on our priorities. For those regions included in the regional orders, we ask that you prioritize these critical over the optional for the next 2 weeks. So what does this mean? It's not that different from when we were addressing the issues that we were faced with in March and April of this year. There are some activities that can and must continue. We know we need to get groceries. We know we need to have our healthcare system functioning. Medical treatments and surgeries need to continue. Most businesses can and should continue to stay open with their safety measures in place. You can still go to work, but if you are able, this is a time to take a pause and consider working from home for a period of time. You can still go out for dinner, but make sure you are following all of the restaurant's rules without exception. We know that when those rules are being followed, that includes maximum of 6 people to a table, not going in and socializing, wearing masks when you're going in common areas, not having people grouping together within the restaurant. Those work when they're enforced and when people are following those rules. We know that you can still get married and have those important events like funerals, but we also know that these can be done with adequate protections in place, small numbers in places like churches, in places like funeral homes or in cemeteries. But what we have seen, it is that it's the events after or around these important ceremonies where transmission happens, because we don't have safety protocols in our homes or in places that we go to celebrate after some of these events. So that's why, for this period of time, receptions of any kind, at home or elsewhere, are not allowed right now. We're putting a pause on those parts of this. So if you are somebody who's planning on getting married in the next few weeks, postpone that reception to a time when it is safe. And if you do have funerals or weddings, make sure that you have small numbers and that safety plans are in place. Right now, we need to reduce our social interactions and social gatherings so that our essential work and school and healthcare can continue. I am directing now that we need to think about the things that we did in the spring. Socialize virtually. Check in on those that you're close to. Plan parties and celebrations for next year when it is safe for us to get together again. And we will be able to get together again. We need to support our neighbors in our communities. We've seen this before. We need to start going back to that. Instead of having people over for dinner, drop off something for somebody. Check in on your elderly neighbors to make sure that they have what they need. And you can safely take things to people right now when we're all taking a step back from having our social interactions. If you are in doubt about whether to travel or whether to see somebody, right now, don't do it. This is our time to regroup. So say no to those play dates right now. This is not the time to have those social interactions. If you have visits planned from friends or family, or you're going to visit friends or family outside of the region, now's the time to postpone those. Do it at a time when it is safe. We know that when we come into an area where there's higher transmission in the community, we take on that risk and we bring it back to our communities and our families. We need now to think about adjusting our routines so that we see fewer people right now. These small steps are important for helping us break these chains of transmission. It is a short time, but in doubt, go virtual. Postpone social visits, whether it's coming or traveling. Attending medical appointments or groups or counseling, things like AA or NA, those are not social gatherings. Those are things that can continue as long as you have adequate safety protocols in place. And go outside. We've said this from the very beginning of this pandemic. Yes, it's safe to be outside. Be outside with one or two of your friends. Go for a walk. Keep your distances. But no backyard barbecues right now. Those are the types of activities that we need to suspend because we know when we get together, it's very hard to maintain those safe distances. And we are seeing that that is a situation where this virus is taking advantage and is being transmitted. So don't have your backyard barbecue. Postpone that brunch with your good friends until another time. I've been asked many questions since Saturday, and there's a number of things that we can put together on this. I've been asked things like, is it okay to have our Scout Troop meetings or our Girl Guide meetings? Or, these are important things. We know that these are important things for our kids. But right now, let's all be inventive and go back to the resourcefulness that we showed early on this year and do these things virtually. It's not forever, but it is for now. We also ask every business across the province, not just in the Fraser and Vancouver coastal health areas, to revisit your COVID-19 safety plans. We said this a few weeks ago and I am reiterating. Now is the time to do everything you can to ensure you are protecting your employees and your customers. And businesses operating in Vancouver Coastal and Fraser Health, we know now we must ensure that all of your employees are doing a health check before they come into work every day. And there's many ways that you can do that by actively using apps, virtual check-ins with people. But we want to make sure that all of us are staying healthy and only going into work when we can, when we are healthy. So we can do this through an app, through online protocols, but we need to remind people to self-screen every day before we come to work. We also know that WorkSafe BC and the BC CDC and our public health inspectors across the Lower Mainland will be stepping up inspections, particularly in some of the high-risk areas like some of our food processing plants and other areas where we know that there needs to be important measures in place. But we need everybody who comes into work every day to say, yes, I did my symptom check and I am okay to be here today. And if in doubt, stay home. The other areas that we talked about on Saturday are indoor sports. For those indoor sports that are non-contact, you can continue to play these sports like curling or swimming in pools. But We need to pay additional attention to not congregating, particularly in areas on the side of the pool or before or after or in the locker room. Those are things we need to pay attention to right now because we see this virus being transmitted when we're gathering together waiting for our kids to come out of the arena. Those are the times now that we need to pay attention to. We need to think about, for those contact sports that are being played indoors, we need to go back to what we call phase 2 with the Be a Sport recommendations, where we're not playing games with each other, we're not having scrimmages, we're doing drills and practices. It is incredibly important, of course, for us to continue our activities, our physical activities. We want young people in particular to get out there and to move, but we need to do it safely. And right now, with this virus being transmitted in our communities at the level it is, we have to take additional safety precautions. For outdoor sports, we can continue to play our games, but we are not traveling. There was traveling happening between regions, and right now we need to pull back and only play within our local area. And we need to again pay attention to not having spectators congregating and talking with each other and the potential for spread in those areas. Finally, I want to talk a little bit about indoor group activities, and those are, rec centers and gyms and studios that have indoor group physical activities. We have come to learn, as we do a lot about this virus, that the guidance and safety requirements that we have had in place for spin studios and yoga studios and group activities within gyms, that they are not adequate to protect us when we have this virus circulating at levels that we do in the community now in Vancouver Coastal and Fraser Health. So those are being suspended. We have a team that's working right now on developing and looking at the literature around the world. This is something that has arisen. We thought we had adequate protocols in place, and this is not a reflection on those businesses. It is a reflection that we are continuing to learn about this virus, and we now know indoor situations, particularly when we're exercising vigorously, where there's loud music playing, spin classes are one of those situations, that is a very a situation where this virus can spread very rapidly. And we have seen that happen in studios, in dance studios, in gyms across this province, but particularly recently in the Lower Mainland. And it amplifies the virus because it can spread very quickly to 20 or 30 people who then bring it home or to their workplace, and it spreads from there. So that is why we have stopped these indoor group activities. Gyms who have one-on-one where people can go and they have adequate space and they can work with a trainer or in a 1-to-2 ratio with trainers in specific gyms, those are fine and they can continue right now. What we're talking about is those more crowded, clustering indoor settings where we have vigorous exercise, and we have now learned that that is an environment where this virus can spread quickly. So the new guidance will be coming out in the coming days and will be posted on the BC CDC website, and we will provide you with the process for having your new safety plans for those activities approved by medical health officers before you're able to reopen. I know many businesses have already reached out and are keen to get underway, but you need to hold back on those specific activities until we have the right safety measures to provide you with that advice. And we know that that means adequate space and distance and measures to ensure that we're preventing rapid spread of this virus. I recognize, of course, that taking a step back has an impact on all of us, on our mental health, our emotional health. I mean, it's challenging right now, and of course on financial well-being for many people. With Remembrance Day coming this week, we need to look to our veterans who have shown us how important it is to persevere, that we can get through these dark times, even if there seems like there is more darkness than light. Whether, like me, you served in the military, you have a family, a friend, or you know your community who has served before or does today. Let's honor and support our veterans everywhere by helping to keep our community strong and bend our curve. We know that veterans have sacrificed so much for us, and we are now asking for small sacrifices through this crisis too. I also want to say that while there may be small outdoor events for many communities this year at Cenotaphs, I encourage people to stay home and participate virtually, to support each other virtually on Remembrance Day. And the Legions in BC have cancelled the events that have typically taken place in order to be protective of the people that we are honoring on this day. So attend remote ceremonies, buy a virtual copy instead. We have been through hard times before, and Remembrance Day is a time for us to remember that. Remember that we have been through these hard times, and we can and we will prevail. We can and we will overcome. And we can look ahead with optimism. If we look back to Remembrance Day and the fact that people have come through world wars that lasted for years, but that we came back as a society and were able to support each other, and we have had peace. Those are the things that we need to remember this week. We need to protect our veterans on Remembrance Day, and we need to look ahead with optimism. It may be dark now, but there is light ahead. And we will do it by going through this together, by being kind to each other, being calm, and staying safe. Thank you.
Thank you very much, Dr. Henry. I wanted to start by acknowledging the 5 people who have passed away over the last 2 days in BC, 3 in the Fraser Health Authority, 2 in the Vancouver Coastal Health Authority. As Dr. Henry has said, and as we've talked about, especially in the last few days, it is a very, very challenging time to grieve, to come together for families, and we want all of the families to know that we are with them as they grieve their loved ones who passed away over this weekend from COVID.